short version, what brought you to where you are today? I mean, did you start off as a young guy saying, "Hey, I want to be an anti-aging doc," or probably there were a few other highlights along the way?
Yeah, good question. So the way that I ended up in this field was through a personal experience with it. First off, I was in medical school, and during my training, especially my clinical portion of my training, I was really, challenged by the way that medicine was being practiced.
Yeah.
I didn't want to be a doctor who walked into a room and spent 7 minutes with a patient with my prescription pad out, ready to write a prescription that was addressing a symptom that they had. It didn't feel right to me. I thought that any monkey could do that, and I really wanted to approach medicine from a more preventative standpoint. And prevention is a huge buzzword that everybody likes to throw around in medicine, and health insurance companies like to say it, and hospitals like to say it. But really, prevention, is for most medicine out there is nothing more than and, checking your cholesterol once a year, and giving you a colonoscopy at age 50, and a few other things. But true prevention is really approaching nutrition, exercise, and lifestyle in a way that we prevent disease. And so I really wanted to gear a practice for doing that. And in conjunction with that, I was in my residency, and I was absolutely fatigued. I was in my late 20s, and I couldn't figure out, why I couldn't get out of bed, and people were saying to me, of course you're fatigued, you're a medical resident, you're working, 36-hour shifts.
Right.
Anybody would be fatigued, and that made sense to me, but it seemed more profound than that. When my residency ended, and I started practicing, I had started my own practice, and I was doing general medicine, and I was moonlighting in the emergency room, but I had much more normal hours, and I still couldn't get over this fatigue. And a colleague of mine recommended that I have my hormone levels checked, and my growth hormone level, my testosterone level were profoundly low.
Yes,
And
I've been there myself.
you have, okay, so you understand, and then
yeah.
And once I optimized my hormones, it was like my life was given back to me, And so that's when I really started educating myself and doing post medical school education on optimizing hormones, and that's really what drove me into practicing in this field.
Fascinating stuff. As we were talking just a bit ago before we started, and you mentioned you're seeing more and more younger population, younger guys that are already, maybe presenting symptoms of hormonal problems, maybe some low T. Could you tell us a little about what you're seeing?
Sure. Well, we know that that hormonal decline to a certain extent begins as early as 18 or 19 years old. If you look at melatonin as an example, melatonin, it's a hormone. It's produced by the pineal gland that sits up in the center of the head here, and it helps us to fall asleep and stay asleep, and increases REM sleep, increases stage 4 sleep. Melatonin levels start falling and continue to decline in a pretty much linear fashion from around 18, 19 years old onward. And it's part of the reason why infants and kids and teens can sleep for 14 hours with a marching band in the next room, and then as we get a little bit older, we have a little bit harder time falling asleep, staying asleep. Elderly people have a really hard time sleeping. Melatonin is part of the picture here. And then for men, they say that typically what happens in our late 20s, early 30s is that the hormones we like nice and high, the fat burning, energy producing hormones, the DHEA, testosterone, growth hormone, thyroid hormone, they start coming down, and the ones that we like nice and low, like the fat storing hormones, insulin, all start creeping up, and that's when it happens. But it seems like I'm seeing it in younger in age in my patients, and is it something environmental? I'm not sure. I mean, we live in an increasingly toxic world.
Oh, yeah.
We're bombarded, to EMFs, to pesticides, to environmental toxins, and all of those have been shown, at least in animal studies, to disrupt hormonal systems. And so, it's something that's increasingly curious to me. So.
Yes, that's a fascinating topic. Now, you mentioned EMF. Now, that's something, the industry, quote unquote, position is, oh, well, there's no problem at all. And I know there is a professor at Cal Berkeley who's a specialist in this, who actually has some evidence that looks a little bit a bit alarming. Can you share your position or how you see the EMF controversy?
Yeah, well, I mean, if you think about just the nature of DNA, right? It's very delicate in many ways, and it is subject to electromagnetic forces. I mean, we know that the body works in electromagnetic fields, and so I don't think it's any great leap to think that EMFs are possibly dangerous to us. I think it's certainly an area that warrants some real serious attention, So, yeah.
Would you be concerned with proximity to a cell phone tower more than that's something someone had asked me the other day, and I did not have time to look for it in great detail, but I didn't see any studies on that.
Yeah, nor have I, So, and it's not something that I've devoted a lot of time to,
Sure.
To researching. So I'm probably not the best person to answer that question.
Sure.
Yeah.
Sure. I realize you've got your other. Let's change gears a bit, and let's just talk for some of the people out there. There'll probably be young men listening to this who are probably having some challenges with their hormones. They're noticing. What are some of the symptoms that would be typically presenting themselves?
Yeah, sure. So probably the number one complaint that I get when a patient comes into my office has to do with energy, right?
Mm-hmm.
It's that they're not feeling as invigorated or as approaching life as robustly as they
Yes.
remember doing in their 20s, right? And so, that whole idea of a grumpy old man they notice starts becoming maybe true. And so they have a little bit more difficult time keeping up, whether it's at work with the new young associate who's 25 and his brain is doing this and he's
Right.
working long hours, or guys at the gym that they're trying to compete with doing CrossFit or running or whatever it is, and they're starting to feel like they are getting old,
Yes.
And when that, and that seems to hit guys somewhere around their mid 30s, that they probably is a good guess that guys start coming in and they say, I'm not really quite feeling the way that I used to feel,
Yes.
Sometimes it's a few years younger than that, sometimes it's a few years older than that, but that's probably the number one symptom. Next, sleep is a big one that comes in.
Sure.
Difficulty falling asleep, staying asleep, and that of course runs right into the energy, right? Because if
Sure.
you're not getting adequate sleep, then you're not feeling energized during the day. And nextly would probably be, and it's probably a tie between these two, is weight. People have a difficult time keeping weight off the middle. They're finding that they're eating better than they ever have and exercising harder than they ever have, and they're having a harder time keeping lean body mass on, having a harder time keeping fat off. That and then probably tied with that would be libido or sexual function.
Sure.
Guys just don't feel like they've got the rev that they used to in that
Right.
area. They're not waking up with erections with the frequency that they did, and so those are probably the main symptoms.
Right.
At least for my male population.
Sure, and that last one can be the most troubling, I think, for a lot of guys. In fact, I think from my experience, and I'm doing a fair amount of wellness coaching, and it's one of the things that oftentimes guys are a little bit hesitant to tell you at first until they have a little more trust, or they're a little more desperate, perhaps. But I usually do an evaluation for them and look for problems and challenges before starting to work. People come to me for fat loss, for example, is the main thing. But oftentimes behind that, there's these other things going on, and I find that a lot of that with erection dysfunction, and especially when the guy gets a new younger girlfriend or boyfriend or whatever it might be, and then it's like, wait a minute, can't keep up.
Right. Yo, sure. And you're absolutely right. In a lot of guys, it's a difficult thing to talk about for whatever reason, whether there's a bunch of cultural biases surrounding that I think play in, but yeah, so it's something that I always ask them about and continue to ask them about, right? And as trust builds with our relationship, it becomes less difficult for them to talk about it, and it's an important one, right? I mean, it's sexual health is something that's so important to my patients,
Oh, I'm sure for everyone. Well, that's an interesting point too, because it also, there's some theorize that could be, you could look at erection dysfunction as a biomarker for future problems, circulatory problems, or cardiovascular disease, that sort of stuff. Is that something you've looked at yourself?
100%. Yeah. I mean, it's that whole idea of a canary in a coal mine when it comes to cardiovascular disease, right? Sure. It's like if you have a difficult time attaining or maintaining erection, then it is oftentimes an indicator that there's coronary disease going on, and so there's plenty of patients that if I suspect that, I've referred for cardiovascular workups.
So it would be because there's others that I guess sometimes people think it might just be testosterone. Have you ever? Would you? I guess it varies. In your experience, would you ever notice for example, maybe correcting a low testosterone level, and maybe resolving the erection dysfunction at the same time, or are those totally independent in your experience?
No, they do go together. I mean, that happens all the time when we optimize hormones and erections improve,
Sure.
Frequently, yeah. I mean, testosterone is certainly a key player in that arena, and so optimizing testosterone levels, one of the first ways that guys report to me that that they know their testosterone's working is that they're waking up with erections every morning like they did in their teens and 20s again. And
that's a beautiful thing when you've lost it. And
interesting is that most guys really don't even notice that it's gone until you ask them about it, and then they think, oh wow, yeah, that hasn't happened in 10 years that I've woken up with an erection, and then they get it back and they're like, hey, it's like, everything's working again. They feel really good, It's very invigorating for them.
Oh yeah, it's a terrible thing when the only thing you wake up with is a stiff back.
Yeah, absolutely.
So yeah, that's a really key thing. So Dr. Mike, let's talk a little bit about. Let's just imagine you have a typical, maybe late 30s, early 40s guy who might come in, who's presenting some symptoms of andropause, or some call it menopause, and what would be some of the strategies you might suggest? And we realize everybody's different, but what would be some of the things people might expect if they were to come see you?
Yeah, well, the first thing that we do, and I think this is so important, and I think it's where a lot of doctors fall short, is that you need to really do a thorough evaluation of what's going on in the patient's life, right? So we have a 20-page patient questionnaire that we give them, and that we ask them about what they're eating, what they eat for breakfast, lunch, and dinner, the types of food choices that they make, the timing of the food, We ask them a lot about their digestive health. We ask them a lot about their sleep patterns and also about different stressors in their lives.
Sure.
We have very detailed exercise questionnaire. We ask them about frequency and intensity of exercise and the type of exercise that they're doing and how long they've been doing it for, as well as their medical history and medications that they're taking and supplements that they're taking, because I believe that the only way to really have a true preventive approach and best take care of your patient's hormonal health is to do it with an integrative approach, right? We need to really address exercise, nutrition, sleep, lifestyle, stressors in order to fully take care of our patients. I say that I can write testosterone prescriptions until the cows come home, but if we're not addressing those other things, they're going to be of limited benefit. And I think also that that's probably part of the reason that we have some problems in that area, is that there are a lot of doctors who are sort of recklessly just prescribing testosterone without looking at these other issues, and I think that they're doing a disservice to their patients.
Would that get us into the biofeedback system, and you get the body's, I guess I don't know if it's the hypothalamus, is detecting the higher levels, and then you're getting signals to the Leydig cells and to slow down production, or maybe mixing it up, but
well, no, that's actually that's quite right. I mean, when you prescribe testosterone, right, you're exogenously, meaning if you take it from outside the body in a cream or a gel or an injection, you're signaling back to the brain, hey, we've got enough, so you can turn off production in the body, right?
Yes.
Well, if you're somewhere in your 50s, usually I see it about in patients in their early to mid 50s and older, your body's not really making an adequate amount of testosterone anymore anyway, so it's okay to supplement it from outside the body. But in younger guys, if I have a guy who's 35 years old, right, and we give him testosterone cream, and he turns off his body's production, he's going to decrease his spermatogenesis, and so his fertility is going to go down, which is usually more of a concern for a guy in his 30s than it is for a guy in his 50s. And
sure.
And so, we have alternative medications that we prescribe to guys who are younger, who we want to encourage their testicular production of testosterone versus just giving them exogenous testosterone. So that you're right in talking about the loop in that way. And so, but the thing is that, if we're not addressing nutrition, nutrition, the way that we eat, profoundly affects, not only hormonal production, but hormonal utilization as well, as does our sleep. Sleep profoundly affects it. Stressors in our lives profoundly affect it, The amount of exercise and the type of exercise and the intensity of the exercise affect it. There are ways of exercising which increase hormone production. There's ways of exercising that decrease hormone production, And so unless you're really addressing all of these, my goal for my patients is to have their bodies producing as much as possible, right? And then augmenting where we need it.
Sure. Yeah, that's so key. Yeah. So if someone is doing a lot of long distance running, overtraining for a triathlon, as I know a number of people that I've worked with have done, would that be a typical situation when you might see a decrease in testosterone production?
Yeah, I'll give you a great example. So last year, before the London Olympics, there's a big training camp at University of Southern California here for swimmers from a bunch of different countries where they come and train. And we had a bunch of them coming here for nutritional counseling. We were helping them with some lifestyle and exercise counseling and supplementation. Obviously, we couldn't give them hormones because they're big athletes. I guess we could, but that would be illegal, so we didn't. And so, but these guys, they were from a bunch of different countries. I had about 6 of them here, and they looked like poster boys for testosterone and human growth hormone, right? They had ripped abs. They looked like Greek gods,
Right.
And they had low testosterone. They all had low growth hormone levels. probably from overtraining, right?
Right.
It just goes to show you that too intensive exercise will decrease hormone production. And so we have this whole idea, that more is better,
More is
more is
better.
better.
Oh, yes.
And it's simply not true, and so if we're not giving our body adequate rest in between, there was one Austrian swimmer here who was needing to sleep 15 hours in a 24-hour cycle just to keep his levels normal. I mean, it's that our body needs rest. So one recommendation, if I were to give you no other recommendation for hormonal health, I would tell you to sleep more.
Right. Oh, I'm with you. That's been key for I think it's so important why is it that we tend to give ourselves almost like a badge of honor for being sleep deprived? Have you noticed that? It's almost like, yes, I'm only sleeping 5 hours, and I'm sure with medical school that's something that the docs go through. But even outside of medical school, I mean, so many people almost, it's almost like we want to brag about, oh yeah, I can get by on 5 hours. But I can get by on it, but it's anyway. How do you make someone realize it's so important?
Yeah, well, firstly, I mean, if we look at their numbers, right? The proof is in the pudding a little bit there, right? And secondly, you're right. I mean, you can get by on 5 hours. Most of us can get by on 5 hours, but I always say to my patients, at what cost down the road are you doing that? I mean, and so, and they'll say, oh well, I can't sleep more than 6 hours, and and I always say, well, let's talk about that. Let's work on that. Like, you have to retrain your body to sleep longer times again. Most of us experience that when we go to Hawaii or we go on vacation. After the first few nights, all of a sudden we're sleeping 10 hours. Like, it feels really good. And so, I mean, I make time almost every single day to take a nap. I mean, that I'll do that in the afternoon time. I mean, even if so I'll tell them, get the sleep where you can as well. I mean, ideally it's all in one, long span through the night, right? But you grab it where you can get it. It's one of the recommendations I make.
Oh yeah. Well, there's an interesting talk. There's a TED talk by a Navy SEAL doc down in San Diego. His name is Kirk Parsley, and we did an interview a few weeks ago. Great guy. And he talks about the fact that in his research that 100 years ago, the average person in the Western world was sleeping 8 to 10 hours a night. And it was, maybe it was more than 100 years ago. Maybe it was 150. I don't recall the exact number. But he actually traced it through the Industrial Revolution and the idea of, with the factory workers, it became, there was a big move to get the factory workers, get the factories going 24 hours, and that's when we started to see a reduction in average sleep time.
Oh wow, that's interesting. I would have thought, that's very interesting. I would have thought that it was when we invented the light bulb.
Well, yeah, I think that's right along. I think you're right on the right track as well. I think both of those things, because without the light bulb, you couldn't have the factory working and churning out, production 24 hours a day. And this, so yeah, it's fascinating.
We've all confused our biorhythms with electricity, right? The pineal gland is a light sensitive gland, right? And so the sun goes down and melatonin production goes up, and the sun comes up and melatonin production goes down, and we're interfering with that with artificial light. Like, we're confused.
Oh yeah. Hey, well, speaking of that, with melatonin, do you ever use? What is your take on supplemental melatonin?
Yeah, so I recommend it. I think that it's underused. Quite honestly, first of all, melatonin is arguably after probably the alpha lipoic acid. It's like the second most potent antioxidant, right? Mm-hmm. And so it has incredible antioxidant power. The interesting thing with melatonin is, and I don't know of any other medication that's like this, the effective dose, the range of effective dose from person to person varies dramatically. There are some people that need a half a milligram of melatonin, and there are some people that need 60 milligrams of melatonin.
60?
Yeah.
Oh
To
my
achieve
God.
achieve the same effect. Okay. So I don't. That's 120-fold difference, right? It's like I don't know of any other medication, that's like that. That would be like take 2 Tylenol or take 240 Tylenol or
Right.
something
That's an
incredible.
incredible
Incredible.
variation, isn't it?
Now, with that being said, most patients do okay on, 2, 3, 4 milligrams sublingual, melatonin to help them fall asleep, stay asleep. If I have patients who have been using sleep medications and have been sort of dependent on those, and we're trying to wean them off of those, then I'll use higher dose, 10 milligrams or something like that. But yeah, some people need up to 60.
Wow, that's fascinating. Big difference. So you mentioned if you had patients who had been on a lot of sleep medication, you would probably go at probably they would need a higher dose typically.
Yeah, I usually do that. I usually try them out on a higher dose only because they've been taking something that's strong, albeit not really benefiting their deeper sleep stages.
Right. Now, what about, is that something you would cycle, or is that something something that one could use on a regular basis?
Yeah, I think it's okay to use it on a regular basis, especially if you're at the point where your pineal gland's not really producing enough of it anyway,
Right.
Now, I usually will recommend that patients play with those because, if they're getting more sleep, or then they can try and back off on the dosage and see if they'll do okay. Unless, I try to keep my protocol for my patients as slim as possible.
Sure.
Number one, because the less we need to take from exogenous sources, the better. And the second is they're much more likely to be compliant with what I'm recommending if there's not 40 different things they need to take in a day.
Right. Oh, yes. Yeah. It gets very complicated. Definitely. Well, let me change gears again. Now we mentioned a little bit about toxins, and obviously we live in a very toxic world these days with so many chemicals. What about the detox? When somebody comes in and they want to, and maybe you notice, for example, they have some heavy metal problems. Maybe they've got some dental mercury. Maybe they've got some. Is that something you would deal with in your practice?
Yeah, I don't do heavy metal detox in my practice. With that being said, if I suspect that there's a heavy metal problem, or if I suspect that there are dental amalgams that are problematic for patients or other toxins, then I have functional medicine doctors that I work with that I refer to. I like focusing on the hormone. I really do. It's my favorite thing.
Sure. Oh, that's great. That's great. Fantastic. Now, so like I noticed on your website the Myers cocktail. Is that one of yours, one of your tools, or is that one of your people that?
Yeah. So we use that. We use that in some patients. Typically I'll have patients that I use that for who are feeling extreme fatigue, right? Yeah, or if they've got some sort of chronic illness that they're dealing with, I'll recommend those. And we'll include them here. They benefit, they see real results from them. Regular Myers cocktails for someone who's dealing with things like chronic asthma, or chronic gastrointestinal disorders, or chronic viral infections, they can benefit them tremendously.
Oh, fantastic. Well, I know time is flying by here, so I want to. I know that you've got a busy day, so I don't want to go on too much longer. I'm trying to control myself because this is so many great topics. But just to sort of wrap things up, if you were to offer, your three tips for people that want to manage their aging, is the three most powerful, small hinges that swing big doors. And beyond sleep that we've talked about a lot already, Anything that you offer us a few ideas?
Yeah, don't smoke, number
Don't
one.
smoke.
Yeah, that's an age killer. And so that would definitely be the number one recommendation. Number two would be to really do your best to seek out quality real food diet. And if to the extent that you can relieve your diet of any processed foods, the better off you're going to be. So that means, have meat, if you're a meat eater, or fish, and loads of vegetables, and keep away from anything that's processed. And also, if you're going to have meat and vegetables, if you have access to better sources of those,
Yes.
the better off you are,
So
right?
free range, if you can get it, free range organic meat, beef, and would be much better.
100%. I think that most of the problems associated with meat are because of poor quality. Okay. And then thirdly, I would recommend that you have your hormone levels tested by somebody who knows what they're looking for. This whole idea of normal lab ranges. I have so many patients that go to their primary care physician and they'll check a testosterone level. My doctor told me my testosterone level was normal. And they feel lousy and they come to see me. And he looked at total testosterone instead of free testosterone. Or they're on the very end of the normal range and
Right.
the high end of the range. So it's having the hormone levels set by an age management doctor who's specially trained in this field. If you have a skin problem, you want to go to a dermatologist. If you've got a hormone problem, you want to go to a hormone.
Hey, we need more of you guys in Spain. There's not a lot, and hey, this is a country with a Mediterranean country with a lot of beautiful people, and people are really into the whole anti-aging, age management thing. But there's a big market there. So if you know any Spanish speakers who are young docs who want to come over here, I can help them get set up. Because
I love that. Maybe it'll be a place for my second clinic. I love it.
Look, there's a 2 hours south of here. There's one of the highest income places in all of Europe. It's on the Mediterranean coast. It's called Marbella, and it's jet set. Totally. There's Saudi princes. There's multimillionaire sports stars that own properties there. There's mafia, Russian mafia, guys with their 20-something girlfriends, and it's a crazy place. But I was down there a few weeks ago, and they checked out a few of the clinics just to see what was going on, and they could use some more competition.
Yeah. Oh, interesting. Well, thanks for the tip. Yeah.
Yeah, definitely. Well, Dr. Mike, thank you so much for making time for us, and I'd love to have you back on the show sometime in the future. Do you have a book you may be writing, or something in the pipeline that you'd like to tell us about?
There's nothing in the pipeline right now, but everybody in my field has been pushing me to write one. So I think it's probably going to happen at some point. Maybe that's my 2015 project. So.
Fantastic. I'm sure we'd love to help you promote that in the future. So once again, thanks so much. And this will be going up on iTunes as well as YouTube and a number of other channels. We'll keep you informed. Officially, we're launching in January, and our goal is to get on the new and noteworthy. We've got a strategy. We're working with a business coach who's done this before. So that's why we're going to be we're sort of guarding our interviews, and then we're going to launch with great passion in January.
Great, love it. Listen, if any of your listeners need to find me, they can email me.
Yes, please
directly.
tell us.
Yeah, they can email me directly at drmike, like Dr. Mike, at thebodywellusa.com, or just go to the bodywellusa.com website and they can find everything they need there.
Fantastic. We're going to be we'll put all your contact info also in the show notes that'll go on, with whenever we upload the show on various places. They'll have that. And so, Dr. Mike, thanks once again. You're certainly a great resource that I think people can know, like, and trust just from this short interview, hopefully.
Thanks, Dan. It was a pleasure talking to you.
Hey,
and,
same here, and come. Hey, keep Spain in mind, and work and keep that book in mind as well.
well, okay.
And I'll just leave the last little thing I'll throw out. We're looking at in the future doing a wellness and kind of a wellness health oriented conference for European docs, and that maybe 2015 could be a good place to launch your book.
Oh, love it. I'm in.
Yeah. Okay. We'll be in touch. So
All right.
thanks so much. Have a great day.
Thanks, Dan. Take care.
Thank you. Bye-bye.
Bye.